The best time to do a pregnancy test, it depends on the stage of the embryo which is replaced. So on day 5, which is a blastocyst, we recommend like 14 days from the day of the transfer. However, if it is day 3, then we can add another 2 days. So it will be around 16 days. If it is day 2, it will be like 17 days. One thing that you should be careful of, like to have a pregnancy test just before the recommended time. And this can act in a kind of worrying way, that if you are not pregnant, you start getting worried. However, if you are pregnant or faintly positive or stuff like that, so it can create some confusion. Having a pregnancy test uh, too much delayed after the recommended time that we ask you is also not recommended. Why? Because we need to know exactly if you are pregnant or not so that we can stop the medication. If you are pregnant by a simple urine test, we would like to confirm it with a blood test. And the reason why we confirm it with the blood test, in order to have a quantified number for the pregnancy hormone. As you know that in embryo transfer, although the majority is going to be intrauterine, however, there is a very slight minority which can be an ectopic pregnancy. So despite having an embryo transfer inside the womb, uh, and even like witnessed by the ultrasound guidance and everything. However, it can still retrograde itself in the tube and produce an ectopic pregnancy. So the quantitative beta HCG is very helpful in that sense to try to have an earlier detection of any possibility or risk of ectopic pregnancy. So that's why we always recommend to have both, like a urine and then a blood test.